there, I'm Dr. Melanie Golombieski at Neighborhood Family Practice. I work here as the Associate Medical Director, but most importantly, I'm a family physician. And I'm here to talk to you today a little bit about getting your flu vaccine for this season. So we'll talk through lots of the basics, but if you have any questions that you want to post in the comments, we can answer them later on in the visit of the Facebook Live, or we can answer it later on in the comment section. So just a little bit about me. I am a family doctor. I've been a family physician for almost 10 years now, and as a part of my training, I've done some work in public health and preventive medicine. So by leaps and bounds, I would rather prevent disease than see you when you are in here with asthma or diabetes or high blood pressure. So that's just a little bit about me. I went to medical school at Wright State, and I did my residency training up here in Cleveland at University Hospitals, and then started working at Neighborhood Family Practice right after that. So let's just dive right into talking about the flu. So it is flu season. Many of you may have heard on the news that the CDC, which is the Center for Disease Control, is recommending that everybody be vaccinated by the end of October. There's been a couple of cases in California so far that we've been seeing some pretty severe flu cases there, and so we're really doubling down our efforts and saying get vaccinated early and try to get it in before the end of October. Flu season usually goes from October through May, but really peaks in January and February in our neck of the woods here, but it's different in every part of the world and even different parts of the country. So it's best if we get you in here now, get your vaccine, and it takes about 2 weeks for it to become effective, for you to have a full healthy immune response and protection from that. Many people say, oh, I don't want to get the flu vaccine, I feel just so gross and sick afterwards. Why would it make me feel that way if it takes 2 weeks to respond? So the body is very smart, and so you give it a little bit of something to react to, and it just might do that. So getting the flu vaccine might cause your body to recognize that it's coming in contact with something that's not supposed to be there, and it's making an immune response. You actually want your body to do that. So some people might feel a little bit of soreness on their arm where they get the vaccine. They might feel a little bit of mild fever or body aches. It is not the flu. The vaccine is, the injected vaccine is a dead vaccine. It's not a live vaccine. It cannot give you the flu. So it's not the flu, but you may be either having a slight immune reaction or immune response to it, which is actually a good thing, or we are in cold season. So lots of times people pick up other viruses right around the same time they get the flu vaccine, and that poor flu vaccine gets blamed for everything. So a couple of days of not feeling your best is certainly better than being down and sick with the flu for weeks at a time. So what does a real flu feel like? A lot of people will tell you it feels like I just got hit by a truck. It's the worst feeling ever. If I can avoid that, I will. But the flu compared to the common cold is much more severe. It has a quick, sudden onset with fever, body aches, fatigue. Some people might have cough, nausea, and vomiting, but the symptoms may vary a little bit between people. But the key takeaway is that it is much more severe than your common cold, and it comes on much quicker. You're feeling great in the morning, but by midday you're feeling awful. People with the common cold tend to feel the stuffiness, the congestion, some of those other flu-like symptoms, but they kind of take a little bit longer to develop and aren't as severe. So that's what you want to prevent. That's not what you want to happen to you. Most people get a mild illness from the flu. It's not so bad. You're down for a couple of days, maybe you miss a week of work or school, which has bad effects on your life as well, other than just being sick. But some people are higher risk to getting more severe reactions. So children under 5 and adults over the age of 65. So children under 5 are at more risk for getting a more severe reaction to the flu virus, but really children under 2 and babies under 6 months are a very, very high risk group. So although babies under 6 months cannot be vaccinated yet, they can get their first flu vaccine at 6 months, it's really important that everybody around those small babies can get vaccinated to help protect them, to not bring that virus into your home or around you. Adults over the age of 65 tend to get more severe reactions to the flu, especially if they have other chronic medical conditions, things like asthma, chronic obstructive pulmonary disease, heart problems, diabetes. Some of these things lower or weaken your immune system, and should you get hit with something like the flu, you can get a lot sicker, you can have more severe complications, like pneumonia, heart attack, other serious things that can put you in the hospital or even cause more serious things like death. Last year there was over 500,000 hospitalizations from the flu alone that we've documented, and that number truly is probably a little bit higher because of some of those other complications that can come after, sometimes weeks or even a month after you have the flu virus. So we especially recommend that those people at higher risk get their flu vaccine, over 65, under 5, but everybody should get their flu vaccine, not just to protect yourself, your livelihood, your grades in school so you don't miss school, but you're protecting your family, your neighbors, the lady you sit next to in church. You're going to protect everybody by getting your flu vaccine that you come in contact with. So if you have any other questions about this, you can post some comments down on our Facebook page here. You can call and speak with one of our nurses or your medical provider. You can use your MyChart. We love to answer questions about ways that you can keep yourself healthy, so please do that. And then the other way you can get in touch with us is through our walk-in flu clinics. So now through December, we have walk-in flu clinics at each of our sites. If you want more information about that, just click the link, and you'll learn more about those hours and where you can get them done at. So I think we had some questions come through.
Yeah, so when is the best time to get the flu shot? And if I get it in December, is it too late?
So the best time to get the flu shot is before the virus hits your area. So we think really between now and the end of October is the prime time. The flu vaccine does lose its effectiveness, we think. Some studies say yes, some studies say no, but at least we know it can provide good protection over the course of about 6 months and then may drop off or lower down after that. So December is not too late. If you're slow to the game and it takes you December or January, you should still get it. There are some people who get 2 vaccines in one flu season or 1 year. So children getting their first vaccine, their first flu vaccine ever, will get one to prime their immune system. They'll get a second one to help their body really respond should they come in contact with the flu. And so sometimes we'll be giving those kids vaccines through April or May. So as long as there's still circulating virus in the area, you should get your vaccine.
If I'm pregnant, is it dangerous to get the flu shot?
It is actually more important for you to get the flu shot when you're pregnant. Pregnant women tend to have a higher risk of complications as well. So we should have threw them in that first group when we talked about it. But pregnant women can have more severe complications, especially if they have asthma. They can get more serious things like lung infection. So it's very important for pregnant women to get their flu vaccine. And some of the vaccine, when your body responds to it and it makes an immune reaction, will actually get passed to your baby. So that's one really awesome thing that you can start protecting your baby even before they are born.
Who else is at high risk of developing flu-related complications, and why is it particularly important for them to get their shot?
So aside from the people at the extremes of age, so less than 5, over 65, being pregnant, if you take care of somebody who has a chronic disease, diabetes, high blood pressure, breathing troubles, any types of cancer, you should think about vaccinating yourself to help protect them, especially if you're around them frequently. You don't want to get the flu and then accidentally pass it to them, even before you may not know you have it. So it's important that if you have a friend or family member, that you do that to protect them.
What side effects or risks can come from the flu shot, and could severe problems potentially occur?
So severe reactions can happen with anything really. There was a study that put out there was 10 very severe reactions out of 7.4 million doses of flu vaccine. That's a lot of doses of flu vaccine. And only 10 of those cases had a severe allergic reaction or other severe reaction to it. Most people have mild, if any, reaction to it. A mild reaction is considered pain at the injection site, maybe a little bit of swelling in the arm, and maybe just feeling a little tired or run down after the vaccine. But most people feel fine and have no side effects from it.
Is it true that, is there anyone who shouldn't get the flu shot?
So we used to say that people who had egg allergy shouldn't get the flu vaccine, but now we know that that is not true. If you have an egg allergy, you can still get the flu vaccine. And the reason that came about is the way the flu vaccine is manufactured. They actually grow it and make it in egg shells. So some of the proteins from the egg can be transmitted through into the vaccine in very, very, very like microgram amounts. But we know that to be untrue, that people can't get, often do not get allergic reactions if they have an egg allergy. So if you have that, you should still get the vaccine. If you've had a very severe reaction to the flu vaccine before, so anaphylaxis meaning difficulty breathing, tightening of your throat, if you've had that before, the flu vaccine is not safe for you to get and you shouldn't get it then. But those reactions are very rare and are very uncommon to have. So most people qualify for the flu vaccine. Okay. Well, it seems like there's no other questions right now. So if you have some later on and you want to post them in the comments, we'll be on there and we'll kind of answer those for you. But reach out to your doc or your nurse practitioner or your nurse, the lady at the front desk. Ask your questions. We want to answer them for you. Thanks for joining us, and we hope to see you soon.